Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes, and we have just finished our lecture of listening. I'm putting it at the end of this lecture, which is very important that you have to notice prepositions, articles when you are doing listening. It's very important to notice these things. But now we are going to talk about speaking. Speaking, again, it's nothing, it's practice. Right now, I'm speaking to you. Even if you are listening to me, if you are not, I'm speaking to you. That means speaking needs practice. But in OET speaking, there is one thing different. There is a patient. So in OET, speaking is not only speaking, it's also listening. And when it comes to medical speaking, means OET speaking, listening is the most important tool because you can't tell the patient, see, first listen to me. You will fail. If patient is saying something, you say, okay, don't worry. Yeah, of course, you can explain me first, whatever exactly you are feeling at the moment. So it is very important. So OET speaking is not only about speaking, it's about motivating the patient to speak. So good morning, my name is Bhupesh, or my name is Dr. Bhupesh, but if I act as a nurse, good morning, my name is Bhupesh, I'm a nurse. How may I help you? Well, nurse, I'm having so many problems, I can't explain you. Don't worry, Mr. John. I am here to listen to you only and I am here to help you. I'm the nurse for the day. So please tell me what exactly are you feeling? So you need to motivate the patient. So please explain me what exactly are you feeling? So patient will say, oh nurse, I'm feeling this and this and this. Okay. So apart from this, do you have any other symptom? So ask for more symptom. Do you have any other symptom? Oh, well, nurse, I have this, I have that, I have this. Okay, don't worry. I am here to help you. These things matter the most in OET speaking. That are you with the patient? Are you empathetic with the patient? This is also an NCLEX question as well. That you have to be empathetic towards the patient. First of all, you have to be there for the patient. So we were doing that ethics in nursing, ethics in nursing in NCLEX. So these are the common rules. Obviously, we have to act as nurses even in OET. So that is the main thing. So again, if how to start a role play. Good morning. My name is Bhupesh. I'm a nurse over here. How may I help you? Okay, Mr. John, could you please explain me in detail what exactly are you feeling? What are the symptoms? Then patient will say, okay, Mr. John, I have noted down these symptoms. Do you have any other symptom apart from this? Okay, all right. Okay, Mr. Jones, so I have noted all the symptoms and now can I examine you after symptoms? Either you will ask about the signs. So you say, could I ask you a few questions if you don't mind? Could I ask you a few questions if you don't mind? No, nurse, that's fine. Okay. So, Mr. John, first of all, I would like to ask you, how did it happen? Did, past, indefinite. कैसे हुआ? With did first form will come. How did it happen? Okay. When did it happen? When did you notice it for the first time? So, according to the speaking you have, according to the role play, you can fit in. What, when did you notice it? How did it happen? When did it happen? Okay. Again, yeah, write it. Don't only listen to this lecture, subscribe, but more importantly, write. We have learned everything by writing. So please write right now. Pause this video, write everything what I have told until now. When you will write, then you will get confident. So then you ask questions, okay, do you exercise? Then you come to do. You ask about the present tense. According to the role play again. Do you exercise? Do you smoke? Do you drink? How many cigarettes do you smoke? How much do you drink? Or how many glasses? When you are saying many, many means numbers. So number means how many cigarettes, how many glasses. Otherwise, drinks cannot be counted. So you will say how much. So what cannot be counted? Especially the liquid things. You ask how much do you drink? Otherwise, you say how many glasses do you drink? Okay. So how many cigarettes do you smoke? How much do you drink? Okay, okay. So I've noted down these things. So, Mr. John, now I would like to examine you. Symptoms done, signs done. Third, examination. That is what happens in medical industry examination. So you say, could I examine you, please? Okay. Thank you for giving me consent and let me examine you. You will get marks. Thank you for giving me consent, Mr. John. Let me examine you. Okay. After examination, small pause. Let me examine you. After examination, I have found that you are having whatever the problem is according to role play. Always say this line. After examination, I have found that you are having this. Oh, nurse, it's a dangerous disease. Well, Mr. John, it's not a dangerous disease, and you have come at the right time, and we are here to help you. If it's a dangerous disease, then you say, well, Mr. John, yes, it is a disease to be concerned about, but yes, it is a disease to be concerned about. You don't say it's dangerous. You're a medical professional. You say, yes, it is a disease to be concerned about, but if you will take the treatment at the appropriate time, if you take proper medications and whatever a doctor will advise you, if you follow those instructions, you will feel better. Done? Then now I would like to tell you about the treatment. So, Mr. John, now you need this thing, that thing. When you are talking about the treatment, if you want to take extra marks, then you ask after two or three instructions, you say, okay, Mr. John, can you tell me, have you understood? Okay. So what did you learn about the instruction of taking rest? The nurse, you said me, I have to take rest. It's very important. Nice, Mr. John. You have understood everything. So now I would tell you more things that how to take more precautions. If by chance in the final exam it can happen, maybe John is not aware, your patient is sleeping, he has lost his track. Then if John is unable to explain, then you say, okay, don't worry, Mr. John, I will explain you again. So now please listen. You have to do this, you need to do this. Never say have to, sorry. You need to do this, you should do this. Now, Mr. John, have you understood? Okay, that's great. So if he is not paying attention, then you don't overdo it. Don't get blank. Say, okay, Mr. John, let me explain you again. There should not be a big pause in the recording because, sir, patient did not speak. You said he will speak. Patient can do anything, buddy. Patient might be serious. Patient might be funny like me. Who knows? Right? Take it easy. You have to be there for your speaking. Last, summarization of the task is very important. Some people get 340 sometimes because they do so tasks and then they do not summarize. Summarization in OET speaking is very important. Now I would like to summarize. Summarize does not go fine. So you say, now I would like to highlight the key points again for proper understanding that Mr. John, you need to do this thing, you should do this thing. And if you follow all these instructions, you will have a speedy recovery. Also, I'm giving you a pamphlet. It contains all the information regarding what we have discussed, or you can name the condition. Suppose the topic is about multiple sclerosis. So I'm giving you a pamphlet. It contains all the instruction, or you can say leaflet. I'm giving you a leaflet. It contains all the instruction regarding multiple sclerosis and its treatment. And I reassure you that if you follow these instructions, you will have a speedy recovery. Thank you. Take care. Don't say thank you very much. Thank you. Take care. And if you need anything, in this leaflet, there is also a contact number. You can contact us on the same number, and we are here to help you. Guys, don't go. Please understand. First, symptoms. Normally, symptoms, signs, examination, treatment, summarization. 5 points. Symptoms, signs, examination, suggestions, treatment, summarization. If any step is not there, then sequence will remain the same. Symptoms, suppose there are no signs. Symptoms, examination, then I forgot treatment, and then suppose examination and signs are not there. Symptoms, suggestions, and summarization. That's it about OET. And again, don't listen to this recording only once. Listen to it 3 times. Write it right now because every day you will have the same kind of speaking. Write it. Finish it today only. Sir, if I will do speaking only, I will not be able to rest of the modules. Buddy, if there are 4 modules, if you can cover one module today by listening to this speaking 3 times, then 3 modules can be done some other day. Tomorrow you can focus on writing for 3 days. In 4 days, if you can complete 2 modules out of 4 modules, what better can you do? The problem is that we want to do all the modules every day. That's fine if you are free, but if you're a nurse working somewhere, do little by little. But whatever you do it with quality. Quality matters. And that is what Dr. BKM is all about. Subscribe our channel and follow us for the best OET and NCLEX videos. I'm also putting a thumbnail in the end for OET listening, what we have done today, what we have recorded today. A small listening video for you all. Thank you very much.